Hello, everyone. Welcome to the P2 Network PIM-POCUS lecture series. My name is Maher Abulfaraj. I am a POCUS-trained pediatric emergency physician at Arkansas Children's Hospital. Today, we will be reviewing the ultrasound findings in pseudoaneurysm. We will go over the indications and the basic techniques for acquiring ultrasound of the soft tissue or soft tissue lesions. We will review normal anatomy, followed by some of the pathological findings, the typical findings for pseudoaneurysm. And finally, we will discuss one of the interesting cases. So indications for scanning soft tissue in general, if you're presented with any lesion in soft tissue that could be swelling or just erythema, you can do an ultrasound of the soft tissue to further characterize what's going on and know the causes. In pseudoaneurysm specifically, you'll have a swelling, the patient presenting with swelling with history of trauma, or you would see a scar in the area where the lesion is. We use the linear probe to scan skin and soft tissue lesions because linear probe is a high frequency probe and that gives you a very sharp image. As you're going to scan deeper structures, and pseudoaneurysm can be deep depending on the area or the location of the pseudoaneurysm. If you find yourself going deeper, you can use a curvilinear probe for evaluation of a pseudoaneurysm. Now, the technique for image acquisition is very basic and it's similar for mainly all soft tissue lesions. You want to get the images in two planes. So starting with the long axis, to start scanning from the normal tissue and slide through the lesion into the normal tissue on the other side. And once you see where the lesion is, you would want to put some pressure on it to check for any changes, and also apply color Doppler to evaluate vascular structures from non-vascular structures. And also you want to repeat the same steps in short axis. In any structure that has more than one part in the body, like if it's an arm or a leg or even the side of the face, scanning the other side would be very helpful to know how normal looks like in this patient. Now we'll review a few images of normal soft tissue scans. Here on the clip on the left, you'll see skin at the top with subcutaneous tissue there. That hyperechoic line represents the superficial muscle fascia and then muscle underneath. And this is a still of the same clip here on the right side with imitations of the skin, subcutaneous tissue, fascia here, and muscle. Another example of normal anatomy here. So at the top, we have the skin, which is made up of the dermis and epidermis. We have subcutaneous tissue and the fascia here. We can clearly see the muscle fibers in this still image. And then finally, this hyperechoic line represents the bone, and we typically don't see anything behind bony structures. And finally, this is a scan through the forearm, or still image of a scan through the forearm. We can see skin and subcutaneous tissue. We can see the superficial muscle fascia here and muscle layer underneath. Another layer of fascia here. And as we track towards the left side of the screen, we can see this honeycomb appearance that represents a nerve, and then three anechoic structures underneath that nerve. Those represents an artery and two veins. And finally, at the bottom here, we see bone. So this is just a review of the normal anatomy. Now we're going to talk about the common findings, or first we'll review the pathology in pseudoaneurysm. So blood vessels normally are made of, the walls of blood vessels are made of intima, media, and adventitia. Now, if there is an aneurysm or a swelling of part of the wall, if the wall of that swelling or aneurysm is made of the same layers of the wall, which is the intima, media, and adventitia, that's a true aneurysm. However, if it's made of a fibrous capsule, this is a false or a pseudoaneurysm. So how does pseudoaneurysms form? They're typically formed after a blunt trauma that causes a nick or a tear, a small tear in the blood vessel. And then blood will collect, leak and collect around that area. the body will form a fibrous capsule around it. And as the lesion reorganizes, it will form a cavity that connects to the blood vessel, and blood will flow into the lesion and back into the vessel. Now, we said most common cause of pseudoaneurysm is blunt trauma. However, there have been reports of pseudoaneurysm following penetrating injuries and following some even cannulations of veins and arteries and arterial lines. Pseudoaneurysm should be high in differential when presented with a swelling in soft tissue or even deeper structures following blunt or penetrating injuries. The most common sign is finding an anechoic lesion, and once applying color Doppler, seeing turbulent blood flow in that lesion. So you'll see both red and blue color in the lesion that represents blood going away from the probe and towards the probe. And this represents the yin and yang sign. Another common finding is called the to and fro sign. And by this, you're actually seeing bidirectional flow into the lesion. We get this by putting pulse wave Doppler when putting the gate at the neck of the lesion. And we see waves going in two opposite directions. So if it's going through the lesion or to the lesion, it goes in the positive direction, and then once the blood is going back into the blood vessel, it goes into the negative direction. And this is called the to and fro signs. Now we're going to talk about an illustrative case, and we'll see that there may be small other findings that give you a hint that we're dealing with a vascular lesion. Our patient here was a 3-year-old male who presented with left-sided facial pain and swelling. It was just noted the day of presentation. It was noted that it's getting more painful and bigger as the time passes. However, they don't report any color change. There was no fever and no changes in the patient activity or oral intake. They report upon further questioning that the patient had an injury in the same area 5 days ago. He was at a party and sustained a large deep laceration in that area. That was repaired at a different facility. It was reported that the laceration was 5 to 6 centimeters going from the angle of the mandible towards the mouth. It required operative closure with plastic surgery, and upon exploration, there was no active bleeding. The parotid gland was exposed, and neurovascular bundle, and they were intact. And it was noted that there was laceration of the masseter muscle. All those, that lesion was repaired in layers, and the patient was discharged home. Now, as he's presenting 5 days later, his vital signs were normal. He had a clean healing wound. The sutures were still in place. There was no erythema or discharge noted at the site of the lesion. And swelling was noted in the mandibular area that was going over the mandible into the neck. The swelling was tender, it felt firm, but it wasn't fluctuant. Now, at this point, the differential diagnosis was huge. Basically, is it a complication of the injury, the initial injury? Is it an inflammatory process? Is it parotitis, especially with that going over the mandible into the neck? Or leak of parotid gland secretions? Of course, an abscess is one of the things we always think about. And then lymphadenitis is another one in the differential, although less likely. As we went ahead and did an ultrasound of this lesion, we can see here in this still image, there is a hypoechoic or anechoic structure just underneath the skin and subcutaneous tissue and like the superficial muscle. And there was some thickening of the superficial tissue there. And when we look at this clip, you can appreciate some pulsatility to that anechoic lesion. You can see here again that pulsatility and pulsation in the lesion, which gave us a hint that we may be dealing with a vascular injury rather than an abscess or an infection. Now, as we put the color Doppler here, you can see something similar to the yin and yang sign, where we're seeing basically the turbulent blood flow within that lesion. And this is a still image of the same clip, and you can see we have turbulent blood flow going in both directions. We have the green, the red, and the blue. So the patient was taken to radiology, where he got a comprehensive ultrasound, and he was found to have a pseudoaneurysm of the distal facial artery. He went with IR for coil embolization, and they found the 5 millimeter by 6 millimeter aneurysm there. He was, after putting the coil, he was observed in the ICU overnight, and he was discharged after 1 day of observation. And on follow-up, the patient has been doing well, and the lesion seems to be resolved. So, summary of those pseudoaneurysm ultrasound. I think the most important thing is to keep a broad differential for skin and soft tissue lesions. Not any swelling is an abscess or a lymph node, especially with a history of trauma. There's a risk of a vascular lesion. And then always put color Doppler with any skin and soft tissue exam, as it will help you differentiate between vascular lesions that you should not do an incision and drainage to, and or an abscess that you can do a skin and soft tissue. You can do an incision and drainage. And finally, if there is any doubt, just get a comprehensive ultrasound and look further into the lesion. Well, thank you very much for tuning in. I will be happy to take any questions. You will be able to find my email on the website, and those are my references. Thank you very much, and have a good day.